It's the way that you smiled with serenity, and how you forgave all your enemies. I will always hold your love with all your teachings in my heart. You called everyone, say believe in love. Oh, Muhammad, you are my hero. You are my hero. You are my hero. Always my hero. You are my hero. You are my hero. You are my hero. Always my hero. You are my hero and I keep you safe in my heart. You are my hero till the end and from the very start. You are my hero and you'll always be the best part of every single day. I will follow you. You are my hero and I keep you safe in my heart. You are my hero till the end and from the very start. You are my hero and you'll always be the best part of every single day. I will follow you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Atikah binti Muhammad Ikhwan, third year physiotherapy student of IIUM Kuantan. I will be the moderator for today's webinar forum titled Post-COVID Exercises, a Window into a Better Healthy Lifestyle. For your information, this program will be recorded for documentation purposes. So before we start, I want to invite Brother Muhammad Rujhan to conduct dua recital. Please welcome.
Assalamualaikum. Al-Fatihah. Bismillahirrahmanirrahim. Alhamdulillah rabbil alamin wassalatu wassalamu ala asyrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma innaka ta'lam anna hadhihi al-qulub qad istamat ala mahabbatik wa lataqat ala ta'atik wa tawahhadat ala da'watik wa ta'ahadat ala nasrati syari'atik fawathiqillahumma rabtadaha wa adimuddaha wahdiha subulaha wa amra'aha binurika alladhi la yakhbu wa ashrah suduraha bifadil iman bik wa jamil tawakkul 'alayha bima'rifatik wa amitha 'ala syahadati fi sabilik innaka ni'mal maula wa ni'man nasir. Sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wa sallam. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin.
Amin amin ya rabbal alamin. Thank you Brother Rujhan. Before I proceed to our main agenda today, which is we are going to discuss with our two panels from students of Physiotherapy Department IIUM Kuantan, I would like to say thank you to everyone, thank you to all lecturers and to all participants for spending your time to join our webinar today. I hope everyone will get benefits from today's input. Alright, so without further ado, let us invite our panels for today. Please welcome our first panel, Brother Muhammad Rujhan.
Assalamualaikum. Hello. My name is Muhammad Rujhan Subari from third year physiotherapy.
How are you?
Alhamdulillah, I'm fine.
Okay, so this is our first panel, Brother Rujhan. And now let us invite our second panel, Brother Izzat.
Hello, Assalamualaikum guys. How are you doing?
Hi, Brother Izzat.
Hi.
How are you?
Alhamdulillah, I'm doing good.
Okay, so today, Brother Rujhan and Brother Izzat, the title for today's webinar is Post-COVID Exercises, a Window into a Better Healthy Lifestyle. So mainly, we are going to discuss about what are the exercises that post-COVID people can do to maintain or to improve their body function, including the quality of their life. So our panels, are you ready?
Yes, let's go.
Okay, before we go into the details about what we are going to discuss today, let us know a little bit about what is the role of physiotherapists during the COVID-19 pandemic era. I will invite Brother Rujhan to answer it.
Okay, Bismillahirrahmanirrahim. Okay, mainly physiotherapists, usually physiotherapists is using non-conservative approach technique whereby we will provide manual therapy or prescribe any exercises. Mainly physiotherapists, we will treat based on musculoskeletal problem, neurological problem, and cardiorespiratory problem, and also sometimes in sport. So mainly, but during this COVID-19 era, COVID-19 usually gives symptom mainly affect their cardiorespiratory function. So usually during the patient being diagnosed with COVID-19, usually help them in ventilatory support in order to maintain their oxygen saturation in their body, and also after post-COVID, after they have been recovered from the COVID-19, we will help them to regain back their cardiorespiratory function back is to their normal. It means like usually we will have other like our cardiac function or our stamina will be lowered down as we have been diagnosed with COVID-19. It will give much impact on the lung function. So physiotherapists function mainly help them to rehab or to regain back their cardiac function and lung function. So before I proceed further, COVID-19 was being declared by World Health Organization on March 11 as a pandemic. So, but nowadays it is reached endemic stage whereby all vaccine have been retrieved easily in all country. So, but we cannot neglect that the the side effect of the COVID-19 itself, it still give impact to our current health. So that's why we physiotherapists function in there to help them to maintain their cardiorespiratory function as normal. For example, again an example or an analogy. Okay, Mr. A can jog for 20 minutes before he being diagnosed with COVID-19. But post recovery or post COVID-19, he only can walk or only can jog only for 5 minutes only. Okay, this indicate that the impact or the complication of COVID-19 itself to the cardiorespiratory function on in our body. I think that's all from my opinion. Thank you.
Alright, thank you so much, Brother Johan. I think not many of us know the role of physiotherapists, especially during this endemic era. But it's okay, right now we already know that during this COVID era, physiotherapists actually helps people who had been infected with COVID-19 to gain back their body function, especially the organs that involve the breathing. All right, so I'm pretty sure most of us know what are the symptoms of someone who had been infected with COVID-19. And the most common symptom is fever. But now, maybe, Brother Izzat, can you please share with us what are the common problems that post-COVID people experiences? Please, Brother Izzat.
Okay, sure. So, the National Institutes of Health refer to long-term COVID-19 symptom as PASC, which stands for post-acute sequelae of SARS-CoV-2. More common terms are post-COVID syndrome, long COVID, or long-term COVID. People living with post-COVID syndrome are sometimes known as long haulers. Be aware that there are no clear related factors associated with long COVID yet. They could be due to organ damage, persistent inflammatory autoimmune response, or another reason, but none has been confirmed. According to CDC, the Centers for Disease Control and Prevention, on 2021, the most common lasting symptoms are fatigue, which is 53.1%, shortness of breath 43%, joint pain 27%, chest pain 21%, and lastly cough and excessive phlegm. Other issues include cognitive problems, difficulty in breathing, difficulty in concentrating, depression, muscle pain, headache, rapid heartbeat, and intermittent fever. So that are the common problem that post-COVID patient experiences.
Okay, thank you, Brother Izzat. So basically, the most common problems that post-COVID people experiences are such as fatigue and shortness of breath, and chest pain. So based on the problems stated just now, Brother Jahan, what do you think are the suitable exercises that can be given to them?
Bismillahirrahmanirrahim. Based on the problem stated just now by Brother Izzat, okay. First of all, whenever we want to prescribe any exercise to the patient, firstly, COVID-19, the most impactful side effect is the oxygen saturation in our body. So the first thing first, we need to help, or we need to teach patient, we need to educate patient, or we need to educate uh, to the post-COVID-19 that they can increase they can maintain their breathing pattern by using we call as sleep breathing. Okay, this technique is mainly is to improve or to control our shortness of breath, or in medical term we call it dyspnea. Okay, this breathing technique, it will prolong your exhalation, and then it will also increase your oxygen diffusion rate in your lung. So other than that, it usually it will improve your quality of life, and to those to develop we was diagnosed with COVID-19 until stage 3 to 5. So based on an article on Abu Bakar Siddiq 2020, to those COVID-19 patients who develop pneumonia with productive sputum, this technique usually being taught to them as they usually develop shortness of breath. Also, this breathing technique is not also for post-COVID-19 for post-COVID-19 only, but it also can help to those who being attacked, or to those who develop anxiety attack, in order to maintain their breathing pattern. Okay. What the differences of this breathing technique compared to others is, this technique, you will breathe in through your nose and breathe out through your mouth. But during your breathe out, or during your exhalation, you will breathe out longer than normal, and then you will pucker or purse your lip like this. Okay, it's like you want to blow a candle. When you want to blow a candle, you will purse your lip or pucker your lip. Or also you can pick a tissue and put it in front of your lip, like you blow the tissue, and the tissue will fly. Okay. Okay, the first technique is you sit upright, and then breathe in through your nose and breathe out through your mouth, while purse your lip like this. Let me introduce first. Okay, like that. But sometimes when we are doing sometimes to those COVID-19 post COVID-19, when they are doing normal activity daily living, like such as cleaning their house, or bathing, or any other, they cannot find a suitable position or suitable place to do these exercises. So, based on Irish Society of Chartered Physiotherapists, they also call relaxed position, whereby we can do this breathing technique also in a standing position, or in sitting position, or even when we are on our bed. So, whenever shortness of breath come attacks us, or during to those COVID-19 post COVID-19, first, the first thing first, you need to stop moving or stop speaking, and then calm yourself by focusing at one point. And then you can do this first sleep breathing technique to maintain your breathing pattern, and to make sure that you will take sufficient enough oxygen to supply to your body. So, so we will show you a video, a proper video, to show you to how the technique will be conducted. Okay.
Uh, Other than per-slip breathing, we also have diaphragmatic breathing. We have muscles around below the rib cage called diaphragm, which serve as the main respiratory muscle. Diaphragmatic breathing strengthens diaphragm and in turn encourage full oxygen exchange and decrease the breathing effort. This exercise is suitable for those who have irregular fast breathing and insomnia. Recently, Yu Liu in 2021 made a research about the effectiveness of this breathing exercise, the diaphragmatic breathing, among insomnia, and has been proven helpful. So this is how to perform the diaphragmatic breathing. So the patient need to be in semi-fowler position. The semi-fowler position is this position as you can see in the slide, lying down with back lift a little bit and pillow under the knee. And then the therapist will demonstrate how to do the exercise first. So we need to put one hand just below the rib cage on our belly. Just put our hand below rib cage on our belly, on the diaphragm. And then take a deep breath through the mouth, through the nose, and make sure when we are inhaling, our belly is pushing our hand upward and outward. We need to make sure that. And hold this position for 3 seconds and exhale through mouth while pucker up your lips. So I will perform it and later we will watch the video. So breathe in through nose and make sure our belly is pushing our hand. So then hold this position for 3 seconds and exhale through mouth while pucker up your lips, like per-slip breathing. So you can perform it 4 times. So that is the diaphragmatic breathing. So let's watch a video about it.
Okay. Next is the third technique is huffing and coughing. Okay, for based on the breathing technique that Brother Izzat and I have taught earlier, those technique is to maintain your breathing pattern, to correct your breathing pattern, and also to increase your breathing muscle. So now, this technique is called as huffing and coughing, or in medical term is called like forced expression technique. Okay, this technique is we want to secrete it out, to mobilize or to slowly move out the secretion or any fluid that within our lung. If we did not secrete out the fluid or secretion in our lung, it will lead to lung infection. so our lung will be easily being attacked by any diseases other than COVID-19. So this technique, they have two component, which are huffing and coughing. Okay, huffing is like you put a mirror in front of you and then you try to steam up the mirror by using your breath. Okay. For coughing, we will want to spit out or any sputum or any phlegm that are located or that are stuck within our airways. So for this technique, first we need to breathe in like normal, because this technique is quite heavy and it will easily fatigue to the easily fatigue you, as so that we need to do this exercise for 3 to 5 times only. So first, breathe in like normal, breathe in through your nose and breathe out through your mouth, and then you will forcefully exhale out all the air within your lung, uh, all your air within your lung out forcefully, and then basically if you have any phlegm or any secretion, make sure that you prepare any bowl or tissue to wipe out or to place your secretion from the lung, and breathe out through your mouth while doing the huffing, like you steam up the mirror forcefully. I do it again, okay? First, like that. You forcefully exhale out the air within your lung. But coughing also same. You breathe in first and then you cough. So this technique you need to do 3 to 5 times, and you need to relax first before do it again to move all the secretion left in your lung. So I will show you. We will show a video about the detail of about to do the technique properly. Okay.